You're welcome.
Okay. All right. Well, good morning, everyone. We're going to go ahead and get started. Thank you all for taking the time to join us today. And special thank you to Zach and Amberly for hosting us. They opened up just for us. They were very excited to have us. So please enjoy their wonderful food as well as the wonderful space. Thank you to former Congressman Tom Perriello for taking the time today to have this important conversation, as well as to all our panelists. So my name is Katie Baker. I am the Virginia State Director of Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one. And we're very excited today because this March, we just released last week this new report that provides a pretty comprehensive outline of the attacks that we've seen from the Trump administration and Republicans in Congress on our healthcare this past year. So everything from RFK and all the shenanigans he's up to, peddling misinformation about vaccines, to what I'm going to focus on, which are the cuts in the, I'm just going to call it the big ugly law that passed last year with the vote of local Congressman Ben Cline, and the impact that that's going to have on Virginians and on our communities, as well as on the expiration of the Affordable Care Act's enhanced premium tax credits, which we're already starting to see the impact of those losses as people have gotten the notices and have already seen their healthcare premiums spike up and have had to make difficult decisions about whether or not to take their healthcare, to keep their healthcare. So the big ugly law that passed last year, last July, did biggest healthcare cuts in history, about $1 trillion in healthcare cuts, biggest cut to Medicaid in history. And as a result of the cuts to Medicaid and the Affordable Care Act, we're going to see up to 350,000 Virginians lose their health care. The majority of that number is going to be coming from Medicaid. And the way that people are going to drop off Medicaid is primarily through new reporting requirements that are designed to throw people off of Medicaid. They are designed to throw people off their health care. One is that people are going to have to recertify that they're eligible for Medicaid more frequently. So I'm just thinking about how last year when I was driving up to my college reunion out of state, I got a call from my car insurance company. And they said, hey, you haven't paid your car insurance, like it's gonna drop off. And I was like, oh shoot, okay, I gotta pay it right now because I'm out of state. But I think if I had not taken that call, would I have lost my car insurance for a short period? That's exactly how people are going to be dropping off of Medicaid, except where it's going to be harder for them to be able to do that. And then the other barrier is there are new work reporting requirements for Medicaid. Most people who are on Medicaid who can work already are. But what the new work reporting requirements are going to do are place a lot more paper requirements on people. It's going to be a barrier for folks. They're going to have to work an average of 80 hours a month in order to be able to keep Medicaid. We're not sure exactly how it's going to be instituted, as that will go into effect next year. But I know, for example, I have a friend who owns a cleaning business that she's trying to get off the ground. She's currently on Medicaid. Her hours vary a lot depending on when she can get clients. Clients cancel all the time, they go on vacation or for whatever other reason. So particularly in this gig economy, I think we're going to see a lot of people dropping off of Medicaid just because of how complicated those work requirements are going to be. There is also a provision, and I won't get too much into the weeds into it, but it doesn't go into effect until 2028, but it's going to be very restrictive on how hospitals are reimbursed through what's called the provider tax. Long story short, hospitals are going to be getting a lot less money back, and that's especially going to hurt our rural hospitals. And finally, we've got all the cuts to the Affordable Care Act through letting these enhanced premium tax credits expire. So before COVID, the ACA tax credits were wonderful, but they were a little bit more limited who could qualify for income limit for a single person was somewhere between $50,000 and $60,000 per year. But during COVID, Congress removed that income cap, and instead of saying, if you make X amount a year, you're not eligible for these tax credits, it said as long as you're not paying more, it would limit it so that you wouldn't pay more than 8.5% of your income on your healthcare premiums, like regardless of what your income was. So that was something that really helped a lot of middle class folks and even upper middle class folks who qualified for it. I've been working with a lot of business owners this last year who had been able to benefit from those enhanced minimum tax credits. Because Congress let them expire, and there was a straight up and down vote in January, and Congressman Ben Fine voted against renewing these tax credits, Virginians have seen their insurance go way up. So I just did an event a couple weeks ago in Richmond with the director of the Virginia Health Benefit Exchange and some state legislators to sound the alarm on that. And during the open enrollment period, as opposed to last year, 19,000 fewer people had signed up. And then even in the 2 or 3 weeks between the end of open enrollment, January 30th, and the date that we did this event, the director of the Health Benefit Exchange announced another 25,000 people had dropped off their plans. So what's happening is people are going to start rolling off these plans when their grace periods end, and it could be up to 100,000 people this year alone who are going to drop their Affordable Care Act plans. And the impact of this is going to raise costs not just for those directly impacted, but for everyone. So Johns Hopkins put out some sort of study that showed regardless of where you buy your health insurance, your premiums are going to go up due to these massive cuts in healthcare that we've seen from the federal government. I know I got my notice in December. I'm paying $100 more per month. I believe some folks here I chatted with said that theirs had gone up as well, and they're going to be paying more per month. So it really is going to impact everyone. The other place you're going to see it is with these rural hospital closures and clinic closures. There's 6 rural hospitals in Virginia at risk of closure. I know Augusta Health has already closed 3 healthcare facilities that folks were relying on, and they explicitly said it is because of this law. It is because they're not going to be getting as much money back in Medicaid reimbursements. Those rural areas depend more heavily on the Medicaid reimbursements, and when people are losing Medicaid, the hospitals are going to get less back. And then you're also going to see additional strain on free clinics, and we want people to go to free clinics, but every person I've talked to from a free clinic has told me they're already struggling with being right at capacity. And we're also going to see it in emergency rooms because these people who are losing their health care are still going to get sick, and they're going to wait until they're so sick that they will show up to an emergency room where they can't get turned away, and that's going to increase wait times, and it's also going to increase costs for everyone. So what we're talking about today is no less than a crisis. I want this to be a pretty informal conversation and really just asking people to speak to your own experiences about what you're seeing either as a result of the healthcare cuts or what you're expecting to see or fear that you're going to see, what you're hearing. I know we have a couple of providers here, what you're hearing from the people you serve and people from your communities. So with that, I think I'll let Dr. Gina Chrysler share her experience and tell us a little bit about what you're doing and whether you're seeing the impact of these cuts yet. Doctor.
I am absolutely seeing the impact of these cuts, and it's horrific, and it's going to escalate. Personally, I am a gig worker. Because I am a caregiver for several members of my family, I have had to take a job where I work as needed. And because of that, I am on the ACA, and I saw my premium go from $879.20 a month to $1,230. It's a $370 increase. And I'm one of the lucky people who, because I lived up to my potential and got my education, can afford it. But that is not the case almost anywhere. So, and the gig workers are predominantly, they go across all genders and all socioeconomic, but it does hit women and mothers. So I work as a hospitalist, and a hospitalist is the doctor that you meet after you've gone through the emergency room and you need to stay in the hospital. And it is the most expensive form of delivery of healthcare that you can possibly imagine because you're using so many resources. And people don't come to the emergency room for a hangnail. And a hangnail is important. If you're diabetic, you have poor vascularization, you don't have good blood flow to your foot, you don't feel your foot, you get the hangnail, it gets caught, it gets ripped off, you have a toe that becomes infected, the infection takes off, and it's not until usually the spouse sees the bloody sock that they get to the emergency room, and by then you've got a diabetic foot ulcer, and if you don't have good blood flow, and if you can't get good blood flow with vascular surgery, the next thing you know, you're start amputation, and it is terrible. And those things don't have to happen. If we can provide early intervention care and preventative care. So I could talk so much about that because one of the other things that's really getting my attention is the distrust of preventative care, specifically vaccines. I've been a doctor since 1998, and I have never seen measles. And I've only seen 2 cases of tuberculosis, and they came because they were either travelers or they were from Asia. And so we are going to see a resurgence of diseases that we've had under control. And I'm specifically concerned not just measles right now, because we've got a case in Lynchburg, and it's the most contagious disease known to humankind. If you get exposed, 9 out of 10 people will become symptomatic, 3 out of 10 will require hospitalization, and 1 out of 10 is going to die. If not immediately, from a pneumonia, but from the sequela later down. Because you get long-term complications from many of our childhood diseases. Chickenpox, which we can vaccinate against, you don't have to have shingles later on in life. Shingles, which we can vaccinate against, which is the same family, you don't have to get. And there's so much of that. So without the treatment and the monies for the HIV and the tuberculosis, and without adequate vaccination, we're going to see disease states that we should never see, that children should never have to suffer through. Mumps. Have y'all ever heard of this one? It's in the measles, mumps, and rubella shot. Mumps was the primary cause of male sterility in the 60s. And when the MMR came out to prevent against it, we're not seeing that.
Wow. I think that's really testament to having somebody like Robert F. Kennedy Jr. at the head of the Health and Human Services.
Absolutely. The fact is that we can prevent so much devastation. I mean, 100 years ago, you were lucky to get out of childhood. Now everyone can get out of childhood. And that's an excellent segue to my dear friend and colleague, Michaela Blosser.
Yeah, we'd love to hear from you, Michaela.
Okay, cool.
You're up. She popcorned you.
Yeah, she did popcorn me, and she done did it.
I did her well. Michaela has an amazing story, and she first became friends with me through my husband because they have a shared story.
We do, yeah. So my name is Michaela Blosser. I'm sorry, I have notes on my phone, so I apologize. But when I was 2 days old, I was diagnosed with cystic fibrosis. CF is a genetic disease that really affects many organs. For me, it's primarily my pancreas and my lungs. So my lung function was about 40%. Now, it was 40%. And so like a typical person would be 100%. And so that's just progression of the disease. When I was born, life expectancy was grim. Like she said, and only people with CF, the only people with CF my parents knew, they'd actually died by the age of 16. And so all my life I've had to do hours of daily nebulizers and a vibrating vest, and an hour in the morning and an hour at night. And that all changed due to a drug called Trikafta. Now, Trikafta is through Vertex Pharmaceuticals, and it is gene therapy that actually corrects the underlying problem of CF. I was a participant in the studies leading to it. The FDA approved it just 6 months because it was so promising. My lung function went from 40% to 60%, which is not heard of in your late teens into 20s for it to go up. Normally it just goes down and just continues to go down until you maybe get a lung transplant. But it has stayed stable even while raising my 3-year-old daughter, who was born via IVF. But without it, I probably wouldn't have her, and I definitely wouldn't be as healthy as I am. And I haven't really been doing my treatments as much because I'm a busy mom of a 3-year-old. And even without doing my treatments as much, it has stayed stable, which is incredible. Trikafta costs $30,000 a month, and this is a 7% increase. The Trump administration has implemented drastic cuts to the NIH and the FDA, thousands of layoffs, over $2 billion in canceled research and halted clinical trials. If Trikafta had to go through that process today, who knows what it would be like for patients like me. It could have been halted. We could not be seeing this. When I was, then that is like, one of the things is the cost of the medication. But then when I was pregnant, I was on my husband's insurance. And I had to fight for every single medication. Now, Gina would know. Like, even, I mean, I'm going to throw them out, but even Creon and Palmazine.
Creon, they don't want to pay for it. Creon is a digestive enzyme
Yes.
because the cystic fibrosis deteriorates the pancreas, and you don't make digestive enzymes, and you essentially starve to death.
Yes, yes.
So you have to take this, and then you can process food and absorb nutrients.
Correct.
And
Yeah. So they wouldn't even, they denied everything. And the broker who sold me this insurance told me to contact the manufacturer and go get samples from the manufacturer because the insurance just was denying it. Now, mind you, I am paying this insurance $800 a month. I don't know what this insurance is doing. So anyway, but then Trikafta has a wonderful, they do have a patient assistance program that is amazing. And it, but that my insurance, they accepted that money graciously, but they did not credit it towards my out-of-pocket. So that means I was still stuck with this really, really high out-of-pocket maximum. And which was actually found out today when I researched it. It's actually legal. Virginia passed the law in 2019 to say that you have to allow the manufacturer to use like the coupons and everything towards your out-of-pocket. And they were not doing that. And so I got stuck. Just actually this last year was the time that I paid off my medical bills for having my daughter in the hospital. Because everything else was through sample products. So I was getting these little tiny itty bitty medications. Anyway.
And she's 3, so it took 3 years.
And she's 3, yeah. So it took 3 years for us to pay it off. Later, my husband's employer told me I should get my own insurance because they can't afford to pay him for like 2 weeks that haven't work anymore, essentially. So I got my own insurance through the ACA. And then Republicans moved to strip it, and we couldn't get straight answers on what it would cost. And so my husband luckily switched jobs, and so I moved to his insurance because I was able to, but we couldn't get a straight answer on how much it would cost. So we're lucky that his job situation changed, but that's not the same for everyone else. Now he is stuck in this job, and it's a pretty okay job, say that. He's a hospice nurse, but he's stuck there because we've already met our out-of-pocket because of Trikafta, and if we would go to switch, we would be stuck, like, we're just stuck. We're stuck, and it's essentially, it's my fault that we're stuck. And that just, I know, it just, yeah. I was just saying, I told him before we started dating, because we started dating when I was 17 and 18, and I told him, I said, hey, I just want you to know I'm expensive. And I want you to know that. And I'm not high maintenance. This is just to let me breathe. So, but anyway, my story may be extreme, but insurance companies and the encouragement of the Republican policy decisions that favor the wealthy over the patients are putting vulnerable people into devastating medical debt, and that definitely needs to change.
Michaela, CF is the most common recessive genetic defect in the world.
Yes. 1 in
It is
30.
1 in 30. It was a death sentence in the 70s.
Yes.
Age 14 to 16 was the usual life expectancy.
And now at UVA Hospital, there are more adult CF patients than there are pediatric patients, which is incredible.
And the things
Not
that have
heard.
done it
Yeah.
have been the advances in antibiotic therapy, the advances in an enzyme called coenzyme, which helps break up mucus, which I think you were in the trials for.
Not for that one.
Well, my husband was.
Your husband was, because he's
Okay.
older than I am.
We're not going there. But no. But it is an incredible testament to why investments in research and development, why investments in NIH are so important.
We are
and
on the brink of huge medical advancements.
Yes.
Yeah, and you can't really pause those studies. Some of those are 20, 30-year trials, and you look at people alive today because of the investments made a generation ago, and now we are cutting those off. That not only has immediate effects on those, everything from bankrupting families to how long you'll stay alive to whether you can have a child, to the generations to come who will not benefit from that kind of research. And then on a practical level, those jobs can go to other countries and other places. I mean, the United States has been a leader on universities, higher education. There's a reason UVA is the top employer in that part of the district. And, we are seeing some of that investment move to Europe or to China and other areas. So first and foremost, it's just the impact on people right now. And that's just a dehumanizing thing to go through. So don't ever say that it's your fault again.
But
thank
it's
you.
worth it because you're priceless.
Yes.
And Trikafta may have a big upfront cost
Yeah.
that can be absorbed, but the tail end over a course of someone's life, it's the much cheaper. Take care of the problem right
Absolutely.
in the
Yeah.
beginning.
And Michaela, I just wanted to build. Thank you so much for sharing that vulnerable story. And I just wanted to build off of a couple of things you said. I've talked to so many people, so many storytellers I've been working with this past year who didn't know what their insurance premiums were going to go up to, and they kept waiting to see if Congress was going to get a deal, to see if enough Republicans would come over to extend these tax credits. They did on the House side. There were just a handful of them, not Ben Klein. And then, but in the Senate they didn't. And so people were waiting, they were in limbo. I had one storyteller who asked her boss for full-time hours and was begging for full-time hours so she could get insurance through her employer because she didn't know what was going to happen. And it's a lot of time. A lot of people who are on the ACA plans are small business owners. So they're taking time away from their businesses to research plans, see if they can get a more affordable plan, be making calls, and it really just made it hard for a lot of people to plan. And then the other thing I was remiss on mentioning that you alluded to was the cuts to healthcare in this big, ugly law were not just for nothing. They were to fund tax cuts for the wealthiest and for corporations. And in fact, I just have in this report here from Protect Our Care, the big, ugly law also included a $9 billion giveaway to drug companies. So that really is at the expense of everyday people. So again, thank you for sharing your story, and I think I'll popcorn it to the other Michaela, who I know is a healthcare provider.
Yes, I had deja vu from everything that she said at the beginning because last year I got invited to an event and the CEO of Augusta Health was there, and she literally said everything that she said. And they had a whole bunch of different nonprofits, and they all were just talking about the new paperwork, and they were saying not only is it new for the patients, but it's new to them. There's like stuff that they've never had to do before that now they're learning how to do. So that prohibits and wait times and all that stuff. And yeah, so I've been in healthcare 11 years. I started out working at assisted livings, and then I built my way up to being a phlebotomist at the hospital. And when I was in home health, I worked specifically with Medicaid and Medicare patients, and then I've dealt with private insurance. And like I said, I was at the hospital. And even sometimes in the hospital rooms, I'm just there to draw blood, but also a lot of times I was a shoulder to a lot of people. Some people, hey, your mom needs this medicine, but because she can't go home without it. And then it's like, okay, but we don't have the money for that medicine. So I've sat and listened to some very personal, emotional, and touching stories of people trying to figure out how to get their loved one home because they stay in the hospital, the bills are gonna pile up. And I've heard some calls to, people begging other people, hey, could you just help me out? I've heard people call their jobs like, hey, can I get an advance? I really just want to bring my mom or whoever home. And sometimes I feel like it's easy to make these cuts or to pass these bills that harm people if you're not the person that's been in that room to listen to those types of phone calls. When I've been talking with my Medicaid and Medicare people, I told them, I talked to the lady, the CEO of Augusta Health, and they've told me some of the things to prepare for, and I'm preparing you guys. A lot of them still are like, oh no, like people just don't like Trump and people don't like Ben Klein, so they just say whatever. And I'm like, no, and I'm like pulling it up. I'm like, this is for real. And they're like, oh, well, we never looked into that. A lot of them said, they just voted Republican because maybe their families have, and so that's been one of my biggest goals this year is to just really do the education and really inform people because a lot of people just don't know. And so yeah, I mean it is sad, and most of the people who I've dealt with who are on Medicaid or Medicare, a lot of them get their food from the food banks. They're already struggling, and just these cuts, it's gonna hurt people who are already hurting and who are already struggling, and so it's just really sad to think about that.
Kyla, can I just pick up on the fact that it's really important to understand that this pain in the community was completely knowable. It was predicted, and it was predicted by the people that do this for a living, the healthcare providers. And it's sort of the minimum of Ben Klein's job to show up and listen to the people that are impacted before he casts a vote. And the Affordable Care Act was complicated. It was a lot of pages. We can talk about the ways in which it's worked, the ways in which it needs to be stronger. These votes were not complicated. This was just, do you want to kick people off Medicaid? Do you want to kick people off of the insurance by not having affordable enough premiums? And anybody working anywhere in the system knows people don't stop getting sick. They just stop getting preventative care. They go to the emergency room, and everybody ends up paying that with higher premiums. So this was knowable. The people who run these clinics were warning that this was going to happen, and now we've had those 3 clinics close. We were talking to local paramedics a couple weeks ago who were talking about their call volume going up because people no longer have access to a clinic. They end up getting the emergency drive to the to the ER, more expensive care, more dehumanizing waits. So just wanted to pick up on the fact that, this was known, people spoke up, and our representatives like Klein either didn't listen or didn't care.
That, even the CEO of Augusta Health, she was like, thank you guys for calling and complaining and telling Ben Klein to vote better, and he still didn't listen. So I think that's very important to know that people were trying, and he still voted, I guess, with his own best interest. And also you have to think, whether it's places like Craigsville or Churchville, Augusta Health is 40 minutes from them?
Yeah.
And a lot of them
Country
are like,
roads.
yeah, a lot of them that I talked to that lived in those, they're like, oh no, it's fine. I don't feel like driving 40 minutes to the hospital. And I'm like, yeah, but once it gets worse, it gets worse. So.
Absolutely. Thank you so much for sharing your story, Michaela, and for your service too as a healthcare worker. And I have another healthcare professional, Kelsey. Would love to hear your story. Tell us a little bit about yourself and what you're seeing.
Yeah, my name's Kelsey. I am currently a hospice nurse. I've done hospice for almost 6 years now. I worked inpatient at UVA and Centera before that. Primarily, the population of people that I work with now, we utilize Medicare. Medicare benefit fully covers hospice services, but the problem that I have seen most is that any additional health costs that someone might have will then automatically go to their secondary insurance. The majority of those people have Medicaid as that secondary insurance. And kind of how Medicare hospice benefit works, if someone's living in a nursing home or in a long-term care facility, as soon as they start hospice, their room and board is no longer paid for by Medicare. And so these places are very expensive by a variety of factors. A lot of people tap into their Medicaid to try to help pay for their room and board somewhere that either they've been living for a long time or somewhere that they have had to now move into and try to feel comfortable in, along with all of their health concerns going on. And so it's just a really big concern having cuts to those things. Michaela, you made me even think of an example. I've had patients who are on medications such as Eliquis, which is a blood thinner. If they've had a stroke in the past or a blood clot, they have to be on a blood thinner for the rest of their life, or else they will likely have another stroke or they could die. So if someone decides to go onto hospice services, their blood thinner is hundreds of dollars a month and will not be covered by Medicare because it's not a hospice medication. And so families have to make that decision of how they're going to pay for this medication that if they stop, they are going to die of something that is completely preventable. That's not, hospice doesn't, we're not doing that in hospice. We want them to have a natural death that is happening naturally while still supporting their body through that. So that's a really big concern. They lose these secondary insurances. Those medications either have to stop or people have to figure out where to come up with this crazy amount of money. A personal example I thought of, my grandpa passed away on hospice a couple years ago. He was in a rehab facility after a surgery and just kind of took a turn when it was apparent that he had about a week left. I was there with my family as they were making the decision to start hospice, and unfortunately a huge factor was if they start hospice, his insurance does not cover long-term care facilities, and so they were looking at paying $600-700 a day for him to stay there and die. And so, it's unfortunate that I saw this with my family, and I know we're not alone, that as you're there supporting someone at the end of life, you have dollar signs just racking up in the back of your head, and it's just a horrible situation. It shouldn't be that way, especially for me, in my experience with end of life. That's such a delicate and vulnerable time. A lot of emotions, and the last thing you want to be thinking about is how are we going to afford this. So yeah, that's one of the big concerns that I have as a hospice nurse. It's already affecting my patients, it's affected my family. And then one other point, I think people have kind of already chimed in with this, is that it's all connected. As my generation, and I see my parents' generation being forced to maintain jobs to afford their health care, it takes away from all these other things. You can't take care of your aging parent and be their caregiver in their home when you have to work a certain job in order to afford a health care that isn't paying for anything anyways. So I see a lot of people, a lot of my patients, their children want to be able to take care of them in their home where they are surrounded by their family and the things they love, but they can't take off work. They have to work so that they can have this health care for their families. And so it's just all connected, and it's a huge detriment to everyone of all socioeconomic status, of all walks of life, and this is just a small pocket of hospice that I see, and it's everywhere. So that's my experience.
Thank you for what you do. I was just going to say with that there are a lot of issues that have come up today about those who are poor, the working poor, those that are most vulnerable. But I think what strikes me from a number of these is how much this is falling on the middle class too. You're talking about people at the end of life who've done everything right in terms of having insurance, paying their insurance, having an HSA, and then even when you've done all of that, at the moment you're most vulnerable, the insurance company is still trying to find a way to screw you over. People are worried about whether to call the rescue squad. How much is that going to cost them when they're, they need to be calling 911. You have people who are making, at the moment they most want to be with their family, are in fact on the phone with insurance companies, probably actually not even a human at this point, with some, AI avatar fighting with them when your loved one is literally dying. And so I'm really struck by that. And there was a lot I wish we'd made stronger about the Affordable Care Act. One piece I think we did understand, which goes back to something you said, is that we are in this together. And I thought we'd gotten beyond the point that there was some sense of like, well, if you just push people off the rolls, it's not your problem anymore. That we are all in it together, whether it's vaccines and people getting measles, whether it's people who no longer have insurance getting put into the most expensive care and late care. I'm on Obamacare for the 4th time. And that's in part because what I think we understood at the time is we no longer live in an economy where people graduate from high school or college, get one job, and hold that for 30 or 40 years. And like you were saying with your husband being stuck in a job, the idea was there should always be a place to go and buy affordable care. And the reason the tax credits exist was the understanding that that wasn't just a matter of getting the working poor to be able to afford it. A lot of it was small business owners and the middle class, and the premiums were that. So if you look at these horrific cuts and the impacts, of course they went after the poor and vulnerable first. But when you get to the vote in January, it was just an up or down vote for the middle class and small business. And it was like, okay, you guys are already paying higher premiums, 300 plus more a month, because of these cuts to Medicaid and more people getting pushed out of the system. And then on top of that, we're going to take away the tax break to help you afford it. And then people are stuck in the situations you're talking about of a dying parent and not being able to know whether you can afford palliative care or hospice. I'm sure
You brought up the Eliquis. Oh my goodness. I've spent so much time on the phone with the cost of not having insurance and patients who need the care and the care is available is that the physicians, the providers, everyone is fighting and for their patients. And you spend so much time with paperwork and fighting the insurance company. I mean, it's technically a 12-hour shift. It's usually 14 to 16 hours. And I would say 4 to 6 hours of that is spent fighting with an insurance company per day. That takes away from what I really love to do, which is practice medicine.
My sister is a pediatrician in Charlottesville. She's the pediatrician of the year most of the last 5 years.
Congratulations.
But she's had 2 of her partners quit in the last couple of years to become life coaches for kids because they aren't actually getting to be pediatricians anymore. They're spending so much of their time fighting the insurance companies and doing paperwork instead of actually caring for kids, particularly for those general practice folks that don't get the same kind of salaries that, say, surgeons and some specialists do. And so the people that are so key to the system, whether it's the hospice nurse or the hospitalist, those are the people that are getting choked out. I mean, if you look at the hospitalist care, you mentioned how expensive it is. It's also one of the investments that saves us money over time. If you are helping people after, say, a surgery and giving them that care that they are less likely then to have a recidivism of a return, the most expensive thing is not actually the hospitalist care. It's not giving them the hospitalist care and then having them have to come back in for another surgery or emergency a few weeks later. And so that little bit of TLC of being able to say, hey, there's an advocate for you in the system afterwards that's going to help you in this scary moment of heading into things. So those were the sorts of things we were supposed to be starting to incentivize with the ACA. And I think instead of building from that, where that was supposed to be the new floor, building up from it, I don't understand why anyone, particularly around here, would want to get elected to Congress to make it harder to get health care, to make it more expensive to get health care, when what we want to be going towards is universal affordable care. And those sorts of cuts the impacts have been immediate on our rural clinics, on the quality of care. And the other thing that you can't ever get back is time. And so when I think about, every minute you're spending fighting for this drug is a minute you're not spending with your 3-year-old, right? And every time that you're fighting for whether the palliative care, hospice care, are those two different things, by the way? Okay, so learning
They're
is
very similar, but
very
yeah.
similar. Every moment that you're spending in the last week of your grandfather's life on a phone with an insurance agent is a minute you're not spending in the last week of your life with your grandfather, and you can't get that back. And that's a system that just should not be allowed to exist, particularly in a country as rich as ours, just so that Elon Musk will get a $300,000 tax credit he's not even going to notice. But it sure as hell going to be noticed by families around here when they're paying $300 more a month for care.
Yeah.
Can I just say something?
Yeah, of
real quick?
course.
Just because you spoke about hospice, I've seen some very, very like traumatic deaths. But when I was 20, this lady had brain cancer, and her family wasn't able to afford her medicine, and so we had her in a special room, and you could literally see the cancer eating away at her, and we still had to go in there and change her and clean her up and all that, and just the amount of pain that she was in every time we had to leave her or just do anything with her. And her family felt so bad, but they didn't have any money. And I just think, like I said, it's easy to pass bills or vote no if you haven't been in these rooms, or if you haven't heard these phone calls, or if you haven't seen this stuff live and in person. It definitely will break your heart.
Yeah, absolutely. Thank you for sharing that. And just speaking, I think a couple of you spoke to, three of you spoke to the high, all of you spoke to the high drug costs. In this report here, we put together the profits for a lot of the big drug manufacturers last year. At Johnson & Johnson, $27 billion in net profit, Novartis, $14 billion, Merck, $18 billion. And these companies are making a lot of money while we have people who are struggling to afford those life-saving drugs that they're making.
Can I just say very quickly on that too? Most of those companies are now spending more on advertisements than they're spending on research and
That's
development.
true.
So let's be clear, we want the research and development.
Absolutely.
We want to be creating that next set of drugs. Some of that's about the investments in the NIH, and some of it is about what we incentivize. And right now, I don't think anybody who turns on their television thinks that the thing we need more of is more drug ads on TV. We'll get into sports betting another time. But if you think about like what is driving that into people's brains right now, this is not money that would otherwise be going into R&D. And the members of Congress know that. Like you can actually regulate that aspect of it and still be protective of the research and development and the ROI that the companies need. We want to be at the forefront of science, but that drug is meaningless if it can't be afforded by the people that are sick.
And I will say with the mind medication, that is a pipeline right now for so many other, because this is gene therapy. So it's like actually like correcting the huge thing. And so like just speaking of the research aspect of it, like type 1 diabetes, there are like so many that are going to be on there. I think they used it for sickle cell.
Yes,
Yeah.
they've been able to use the CRISPR technology
Yes.
to actually.
Yeah. Sorry, not to get into, but
yes.
It is a start. Any medication that there is a start to help other medications. So it's not specifically about one disease. It's about everything too. So yeah.
This just goes, I will try not to be too off topic, but I think this just goes to an overall shift
Yeah.
we've seen in the last 30 to 40 years, which is up until about the 80s. When productivity gains happened, they were split between workers and the owners of the company. And at a certain point, wages became stagnant through that period, and there stopped being a sense that everyone was in this together, and private equity started to hold more and more of that. Same thing is true with healthcare. Like it used to be that there was a sense that we needed to have universal affordable healthcare and not be something that is just, for the super rich. And I think that we need a system where workers are getting paid, because looking at what healthcare providers are getting paid right now, we have so much need in the community for people, and those need to be living wage jobs that are representative of the kind of service people are providing to those who are caring for our loved ones. So this is not something we should be trying to choke out these jobs. This is something where we should be trying to encourage both the investment in the research and development, people moving into these professions and having them be living wage professions, and at least not kicking people off the rolls. And this is one last thing, is just that the Republicans like to talk about too much federal government or too much bureaucracy and paperwork. All they're doing is creating more bureaucratic paperwork
Yeah.
here.
Yeah.
This is, having people fill out paperwork is negative value in the system here. It's using up family and patient's time, it's using up doctor and nurse time, all of it about ways for them to be able to deny the care that people have paid for, which is the whole point that you paid for the insurance. So we over-regulate consumers in this case. At the same time they're taking the regulations off the big corporations, they're making it harder and harder for people to be able to access the very benefits they've paid for.
Thank you. And I do just want to be mindful of time here, so I'm going to just end on a couple closing notes. One, Navigator Polling just came out with a new poll, I think a couple days ago. They went into battleground districts across the country. Battleground congressional districts. I don't think they went into Virginia. But 80% of voters say healthcare is less affordable than it was last year. And 57% say healthcare costs have gone up a lot. And 74% of voters say Congress can do a great deal to lower healthcare costs. And they do trust Democrats more than Republicans to deliver affordable healthcare and prescription drug prices. And I would be remiss if I did not acknowledge, because he's a modest guy and probably wouldn't talk about it on his own himself. But back when
Talking
Tom,
about Ralph?
I'm just here for IQ.
Yeah.
but when Tom was in Congress, he made a very difficult, or I guess he wouldn't call it a difficult vote, for the Affordable Care Act. But at the time, I think there was a lot of distrust, a lot of misunderstanding around what the Affordable Care Act was and what it would do. I know you did 100 hours of town halls all across what was the 5th district and listened to people who were very unhappy, but you cast a vote that was a profile of courage. And thanks to that, we have the Affordable Care Act. That was one of the key votes. So we are very appreciative of that. And I just want to see if you had any closing thoughts.
Sure. So I think in retrospect, it's important not just that I voted for the bill, but actually that I was fighting for it to be stronger. Right up to my last conversation with President Obama before the vote, I was pushing for there to be a Medicare buy-in and a public option and more power to negotiate cheaper drug rates. We need leaders that are pushing the envelope for healthcare to be more affordable, more universal, not folks that are moving us backwards. But the other thing I'll say, just because I think it's really important, is people focus on the 100 hours of town hall meetings, and I think that was a very important thing for me to hear from folks. But every night we would do one of those town halls, we would spend 7 hours before it meeting with nurses, doctors, small business owners, patients, stakeholders. The people who came to the town halls had already made up their mind. They were for or against. I think it's important for a representative to hear that play out. But really what made me smarter and made me convinced that the ACA was very much net beneficial for rural communities was meeting with stakeholders all day. And this just goes back to what Michaela said. Like, anyone who's in that job right now, Ben Klein or John McGuire, should have done the bare minimum of talking to doctors and nurses and healthcare providers and small business owners. And not one of them is going to tell him that this move backwards of bankrupting middle class and small business was a good idea, and pushing more people into the shadows again is a good idea. So I think we really do deserve representatives who show up and listen to the stakeholders who live this every day, like hospice nurses and others. And I think when we learn from those ideas, we can see we can actually improve the system, not just get back to where we were, but we need to get to something much better, whether that's a Medicare buy-in or more. And also, while there are questions of like district lines and the rest right now, it's not like this policy stops at some artificial district line. What happens in Rockingham County matters to what happens in Harrisonburg and vice versa. And if we have a fighter here who's going to listen and push for this healthcare, that's going to be something that's good for the broader region and the valley, instead of thinking that somehow we can play sides against each other. And again, I think the main thing is just to listen to folks who live this every day, as family members and as providers. And I think what you are hearing is overwhelmingly that voters want to see us move towards universal affordable care, and they certainly don't want to be kicked in the stomach at their most vulnerable moments, kicked to the curb when they are small business owners trying to do the right thing by their employees. And that's what we've heard over and over again, is that the richest of the rich will be fine, but everyday folks around here are getting pushed back into the shadows. And that even those who can make ends meet to pay for insurance still then get nickeled and dimed and get that time taken away from families. So it's long past time that we move in a better direction.
Absolutely. Well, thank you so much, Tom, and thank you to all our panelists. Dr. Pear is very grateful for your time, your voices, your willingness to share your stories. We do have several reporters in the room. If you're comfortable with sharing your story, I think some of them might be interested in talking to you one-on-one, but that's totally up to you. And I think we're going to get a group photo together, and then